Welcome to On the Right Side of History with Kansans for Life. Come with us as we connect the pro-life movement's past to present, uncover hidden or forgotten history, and its connections to the battle still raging today. Now, here's our host, Danielle Underwood.
Hi, everyone. I'm Danielle Underwood, and today I'm talking with Cathy Blaeser, Co-Executive Director of Minnesota Citizens Concerned for Life. We're talking about Governor Tim Walz, governor of her home state and now vice presidential candidate for the Democratic Party. So welcome, Cathy.
Thank you. I'm happy to be here.
Yeah, well, we thought, really no one has a better vantage point of this governor of your state and what he could potentially bring to our country than you all. And so we knew that you were absolutely the people we wanted to talk to about him. So first of all, I just want to say it's great to see you again. Thank you so much for coming on. And, I know you agree that this is a really important topic for people to get informed about. We need to know in-depth information about these candidates, not just their talking, not their sound bites, but their record and what they stand for. And so I know that you all are very familiar with him. I wonder if you want to tell us, before we kind of launch into that conversation, tell us about your organization and what you do.
Sure. So MCCL is the largest and oldest pro-life organization in Minnesota. We've been around since 1968, and we've worked since then tirelessly on abortion, infanticide, and euthanasia. And unfortunately, Governor Tim Walz opposes us on all of that. He is very radical in his abortion absolutism. He has passed infanticide laws. Here in Minnesota, we have infanticide as a state law now, and he is worked with the assisted suicide lobby to try to pass assisted suicide in his long-term effort to get a single-payer healthcare system here in Minnesota. So unfortunately, he is a threat not only to Minnesota, and as much as we would love for him to not be governor here, we don't want to see him as vice president either. So he would be a danger to our country in terms of the policy initiatives that he and Kamala Harris would bring to our nation.
That's so interesting because this, the big picture that we're seeing, that is being portrayed for us, right? That we're being told by the mainstream media is that Governor Walz is a grandpa. He's a coach. He's a teacher. He's basically a likable older white guy. And I'm just wondering, who do you say he is if you were going to give the most important descriptors here?
Right. Governor Walz is not your grandpa. He's your grandpa's worst enemy. He is the leader of the most dangerous COVID policy for nursing home patients. He actually brought COVID positive nursing home patients COVID positive patients into our nursing homes for 18 months and had the highest death rate of any state of nursing home patients from COVID, directly resulting from his policy of bringing COVID positive patients into our most vulnerable places. And even he incentivized the nursing homes to receive those patients, and even brought them into nursing homes where there were known issues of containment.
Did he ever give a rationale for why he would decide to do that?
His response to the concerns was to build a morgue.
To build a morgue?
He built a morgue.
That's crazy.
He actually said, we're doing this on purpose. This is an intentional policy. And he built a morgue as an answer to the concerns that were brought forth. When other states like New York stopped bringing those patients into nursing homes, he continued, as I said, for 18 months and only stopped when the legislature forced him to stop.
So we're talking about incredibly vulnerable people who were essentially trapped in these high care homes.
They couldn't see their families. They couldn't have their families visit, but they had COVID positive patients recuperating in their facilities.
That's insane. So when I started looking to him and considering just first of all, that big picture that's being painted for us, and then looking at the things that he's actually supporting. One of the things that I noticed in my research is that he has a 100% rating from the abortion industry giant Planned Parenthood, and conversely has a 0 rating from national pro-life organizations. And I'm assuming that, I don't know if you all do ratings as well, but what rating would you give him?
He has a 0% rating with Minnesota Citizens Concerned for Life. He was in our legislature, and he was a congressman from our state. So we do have legislative ratings for him, and he's definitely got a 0% rating as governor. He has put in the most extreme pro-abortion policy any state could see. He has taken away every safeguard for women and for children, for parents, for Minnesota voters even. He has pulled every safeguard away and just continues to work to line the pockets of the abortion industry, which is why he's got a 100% voting record with them.
Yeah. I noticed that he had said that, I think it was Nancy Pelosi had told him that he needed to dial down his pro-abortion rhetoric, essentially. I think he had said something, he went on record saying that he was so pro-choice, Nancy Pelosi asked me if I should tone it down. And so I think that tells us something, because we know how radically pro-abortion she is. So if she's the one who's telling him that he needs to back down, I mean, that it couldn't possibly get worse in terms of, someone who's out there stumping for the abortion industry itself. In fact, didn't he make some campaign stops? What were those, and did those happen in Minnesota?
Kamala Harris came to our state specifically to visit our largest abortion facility, which happens to be a Planned Parenthood facility here in St. Paul, and he greeted her there and had those photo ops at Planned Parenthood with her. First vice president to visit an abortion facility ever. And so, his agenda for our state has been devastating. We have, in 2023, he led the effort with the legislature to pass the most pro-abortion policy, the Protect Reproductive Options, or PRO Act, which gave every Minnesotan a fundamental right to reproductive health care services, including abortion, sterilizations, all sorts of things that they put under reproductive health care services. But for our purposes, abortion on demand, with no protections for women. He repealed our women's right to know law. So women are not told about fetal development. They're not told about the potential complications from abortions, especially later in pregnancy. They're not told about the options that are out there for them if they wanted to choose life. They're not told anything anymore. We know that our our women's right to know law saved upwards of 2,500 lives every year. Looking at the reports of people who sought abortion, received information, and did not have an abortion. And these are numbers that are coming out of the Minnesota Department of Health. So we know that the numbers are factual to the average person out there, right? It's coming from a departmental report, that the reporting that comes from the abortion facilities themselves. No parental notification. We had a parental notification law. He has tried to strip that law from our from our statutes numerous times. He tried again this last biennium. He wasn't able to actually strip it. It's not being enforced at the moment. So we have no parental notification. And when you give people a fundamental right, fundamental rights mean something. For example, we have a fundamental right to an education. And so I, as a parent, have no right to interfere in my child's fundamental right to an education. I can't stop my child from getting an education, right? So if my child also has a fundamental right to abortion, I cannot, as a parent, stop her from getting an abortion. I do have no right to be notified. I have no right to have any input into that decision, because it's her fundamental right here in Minnesota. And there's no limits on that. It's not within a certain period of time or gestational age. It is up until the moment of birth. And so women in Minnesota have a fundamental right to abortion up to birth because of the efforts of Governor Walz.
Wow, that's shocking. And
It is.
when I hear about fundamental right, I also think about freedom of religion, these essential freedom of speech, right? We're talking that level of
Well,
right.
he also
Classification.
was, yes, and he was a part of an effort this last legislative session to strip religious protections and conscience protections from our laws, to be able to put those rights of gender transition, those rights of reproductive health care, so-called, the right to abortion, above and on a different level than our right of conscience, our right to religion. In the end, we were able to protect that, but it was an all-out effort. And the legislators were very clear that it was a purposeful effort to leave religion and conscience rights out of the laws. You would not have that ability to not provide insurance coverage because of religion or conscience rights. You would not have the right to not participate because of religion or conscience rights. There was an all-out effort to strip those in this last legislative session, led by Governor Walz.
Wow. So Tim Walz would be in favor of removing your right to your freedom of religion, but
Yes.
absolutely elevating the right to abortion above
Yes.
all else.
Yes.
And
that's exactly what he tried to do.
And that would directly impact medical professionals and those who, would previously have been able to say, I refuse to do an abortion as a medical professional because it violates my conscience, it violates my religion, and that would be removed.
So that would also be removed from organizations, from hospitals that have a conscience or religious objection to performing abortions, never mind their individual practitioners. But if there were a hospital that was running and did not want to provide those services, they would not have that right either.
I can only imagine that some people who are listening right now are finding it a little hard to believe. It's almost beyond comprehension that anyone could fight for this. And that's why I think it's so important. And I'm so grateful to you for coming on to tell us this is true. This is what we are seeing on the ground in the state that he is currently leading. And you're bringing us so much important information that will very likely not reach so many voters in this country, so many citizens in this country who just want to be informed about, who the leaders are that they're considering to lead them. You had mentioned, and I hope I'm not getting this incorrect, but I believe you mentioned statistics in your state. Our statistics in our state have been under attack by the abortion industry. And I believe, is that also something that just fell victim to his administration?
Yes, Minnesota has always had really good, robust abortion reporting requirements. And so lots of information on why women are seeking abortions, so we can actually look at the root causes. Why are women seeking abortions? Can we come up with a solution, ways to help them that doesn't involve killing their child? Because that's not typically what they're actually looking for. They're actually looking for help. How do we help them? Information on the gestational age of the baby, information on babies that survive abortions, the numbers of the babies that survive abortions in Minnesota. So we have really good reporting requirements. He tried to repeal all of them. We were able to save most, but they did make some changes. They will no longer report how many children survive abortions. That number will no longer be reported. And they're not going to report on the reasons women are seeking abortions. So again, how do we go to the root problems that she's actually looking for help with when we don't know we're not being told what those numbers are? But I think the most, I'm not even sure I can come up with the word. Unfortunately, the word that always comes to mind is slimy, but we should come up with a better word. The most disturbing thing that they did with the abortion reporting requirements is that we normally would get that report on July 1st of the year following. So July 1st of 2024, we should have had the new abortion numbers, the accurate abortion numbers reported by the abortion facilities to the Department of Health for 2023 when all of these changes were made. But instead, they changed the reporting deadline to be December 31st. So we will not know the impact of the laws that were changed to increase abortions, to provide for abortion up to birth in Minnesota. We won't know those numbers until after the November elections. So
Crafty,
it's
very crafty.
very crafty. They want to do everything they can to get back into office and not let you know the results of the laws that they passed. And I think you can see that happening today in the national elections, where they're not telling you how they're going to do, what they stand for, what policies they're going to bring forth until after the elections.
Right.
They don't want you to vote on their policies, and they don't want Minnesotans to vote on the most extreme abortion policy and what it actually created in our states. They want that secret until after the elections.
Yes, if they'll allow it to come out at all. They're going to probably try what they can. And it's such a similar situation here in Kansas that, our governor, over the course of several years, the data, the state provided data. We had, decent annual statistics that we really rely on, that policymakers rely on, that people who are trying to, come up with more resources for women so that, we can help address some of those social issues, that, to help women have a true choice, that they can choose life for their babies. If they, we want to help women who are looking for help. So the governor here has continued to move the statistics back, the release of that information further down, into the year. And now, now it's looking like they're going to fight us all the way. So we are same as you. We are not likely to see our annual state statistics until probably December. And we traditionally have gotten those usually April through end of May before this governor. So we have who ironically, actually, now that we say this, our Governor Laura Kelly, has succeeded Governor Tim Walz as head of the Democrats' Governors Association. So, I guess we should not be surprised that they're arm in arm, marching to the same drummer, what they're going to be pushing forward. So that's slightly terrifying to think about, all the things that are being pushed upon Minnesotans by this administration, and, that we do not want that to come to Kansas. It's so interesting. Go ahead.
I was just going to say, to your point about wanting to be able to really help women. One of the things that we had here in Minnesota was a wonderful program that I know other states have as well, our Positive Alternatives Grant Program, where we provided a small funding stream to organizations that provide positive alternatives to abortion. So our pregnancy resource centers were able to use that money to be able to answer the needs that women truly have in difficult pregnancies, right? How to help them, get their education, how to help them with the expenses associated with a new baby, how to help them with parenting and fatherhood classes and life coaching. All of those things could be funded through our Positive Alternatives Grant Program. And Governor Walz has a long history of trying to defund that program. He did not like women having additional resources and additional choices. And unfortunately, this past biennium in 2023, he actually, not only did he defund the program midstream, so he stopped the funding that had already been promised to these organizations, just stopped it. Then he also repealed the program itself. So we're going to have to go back in and repass the program and refund the program. So he said no to providing women with actual options, with actual choices. And at the same time, he increased the funding of abortion procedures to abortion facilities. He increased that funding by 20% in 2023 and 20% again in 2024. But we can't even have a small funding stream for organizations that actually provide women with choice. It's one choice and one choice only under Governor Walz, and it's all about death. Death of the baby, death of the disabled infant or the infant that survives an abortion, and death of our nursing home patients.
Wow. I'm not sure how we add more to that. One other thing I wanted to make sure we dug into. You mentioned that your state statistics had documented survivors of abortions. And I think if I read something, if I'm remembering correctly from your organization, it said there have been 5 documented born alive survivors in the
Right.
last, how many years?
Actually,
4
5
years?
a year. There have been between 3 and 5 survivors almost every year over the last 7 or 8 years.
Wow.
They did not survive long term, but they survived the abortion. And we know that from the abortion report that the Minnesota Department of Health is required to put out. We will no longer know that information. And the very disturbing thing that happened was they gutted our Born Alive Infant Protection Act. So we have a law in the books that said that if a baby survives an abortion, that baby has the same right to medically appropriate life and health preserving care as any other baby born at that same gestational age. So it wasn't, you have to do everything. It was medically appropriate life and health preserving care for that particular baby at that gestational age. So if a baby survives an abortion at 15 weeks, the appropriate care is comfort care, because we just don't have the technology yet to save a baby at 15 weeks yet. But if that baby is born alive as a result of an abortion at 22 weeks, 24 weeks, that's a completely different level of care, because we do have the technology to be able to save those babies. There's lots of babies at 24 weeks that survive and have, they're born so prematurely. But what they did here in Minnesota, what Governor Walz and the pro-abortion leadership did at the legislature, was they changed the law to say that any newborn baby in Minnesota, not just babies that survive abortions, but any newborn baby in Minnesota has a right to care. And in all of the committee conversations and on the floor debate, that care was defined as comfort care, not medically appropriate life and health preserving care, but comfort care. Now, we don't think that's going to impact healthy newborns. Certainly, babies that survive an abortion have no chance. They're not going to be documented, and they're not going to be saved. But also, this is a threat to babies born with either known or unexpected disabilities, things that were expected. There's already tremendous pressure on parents when they get an adverse diagnosis during a pregnancy to abort that child. And if they do decide to carry that child to term, there's tremendous pressure already not to treat aggressively, right? Down syndrome babies, other babies with spina bifida. There's already tremendous pressure not to treat those babies. That pressure is only going to increase because now we have a law that says that you don't have to provide them with medically appropriate life and health preserving care. You're only held to the standard of comfort care. So we actually have infanticide in Minnesota now, which is what makes our laws worse than any other state, actually worse in so many instances than North Korea, China, Russia. They're not state sanctioned leaving their babies to die. But we are in Minnesota.
I'm so glad that we covered that more in depth, because that's a whole nother level of evil.
It really is.
Truly is infanticide.
Yes, it truly is infanticide. If a baby survives an abortion, you have 2 patients in the room. You obviously have 2 patients in the room, both of which should be receiving medically appropriate life and health preserving care.
Wow. So this picture that you're helping us understand about your state and what, the governance in your state now, we have to then think about that. I guess I would ask you, what would you imagine if somehow he is elected as Vice President of the United States? What would you envision would be, with that combined Harris-Walz Administration, with them at the forefront and, supposedly leading, what do you think Americans would potentially see?
Well, we know that the Biden-Harris administration has been the most pro-abortion administration that we've seen. Kamala Harris and Tim Walz would increase that, would take it, continue the trajectory. We know that. And we know that they are both inclined toward single-payer healthcare systems. And we know that single-payer healthcare systems do not work without rationing of healthcare. They just don't. You can look anywhere in the world, and people come to the United States on purpose for healthcare because we don't have a single-payer system. And so when you have a single payer system, again, it makes sense to not provide care to the biggest drains on that system, to allow those babies to die, to abort them ahead of time or allow them to die. So abortion, infanticide. And it also makes sense to get rid of your nursing home patients, to get rid of your more expensive end of life patients, right? It's very inexpensive to treat, to do preventative care. It doesn't cost a lot to go in for your annual physical and, be told to watch your diet and make sure you're getting exercise. But when you're sick and you need actual interventional care that is going to cure disease, cancer, heart disease, diabetes, that's expensive. And if you're looking at a single payer system, abortion, infanticide, euthanasia, assisted suicide, all make sense within that system.
And when we say single payer system, we're talking about socialized medicine,
Yes.
just to make sure we're being clear. I think that's one of the things that you and I and everyone else who's part of the pro-life movement and out there talking to anyone needs to help cut through the clutter of their euphemisms that they use, right? So any kind of pretty words, as I call them, to cover up the truth. Again, it's that continuation of covering of the truth by any means possible, whether it's hiding the data or it's using words that completely blanket the ugly truth behind them. We have to make sure that we speak plainly about it and that we help people understand that, just because they're being sold this beautiful package, with this lovely bow on top, that's not the reality that they're actually being presented. And it's so important to not just look at the packaging of either the politician or, in this case, they're not really putting forward that many policies, as you were saying. They're being very, very vague about the policies they're putting forward. But when they do put forward ideas so many times, it's extremely, just very low on details and never talking about the ramifications of those ideas. And it's so important that we understand this. And I think you've done a wonderful job of explaining how that leads to just death on demand. And usually it's not the demand of the person themselves. It's someone else demanding that a person dies because they are, quote unquote, a drain on the system or too expensive or, just in some way, not the easy person to continue to care for or to welcome into the world. When really we want to make sure that we value every person, every human person. Well, you have helped us to understand so much more about him and to really get past that veneer of the coach, the dad, the grandpa, that, all of that we're being told right now. So are there any other things we should know about Tim Walz or anything related to this conversation?
I would say that when it comes to Tim Walz, the saying, don't judge a book by its cover is so true. Open the book up. Go find out what has happened to this state. I mean, I haven't even talked about the George Floyd riot that was right here. Our post office here for MCCL was burned down in the George Floyd riots. It had a direct impact on our organization and on many businesses around here. Our postal services never recovered. Pro-life, the burning of Minneapolis it was atrocious. And he did nothing for that, nothing at all. We have a brand new website up, a brand new landing page called whoaretheyleavingout.com. And it's specific to Minnesota, but these were all policies that were passed in 2023 and 2024 under the Walz administration and under his leadership. And it talks about the extreme abortion policy. It talks about leaving babies to die. It talks about the health, abortion reporting requirements. It talks about the nursing home patients. And we had a huge $72+ billion surplus that he spent, increased our taxes, and practically refused to fund nursing homes within that. So there's some great video of a legislator pointing out all the things that he did fund and he didn't fund nursing homes. He gave under $4 million in a biennium, a 2-year cycle, to our nursing homes. Again, he does not want nursing home patients to survive. He doesn't want them served, and he doesn't want them to survive. And he does everything in his power to bring forth policies that threaten the lives of all of our most vulnerable people. All of them are threatened by this man.
Very important information. Thank you so much. And tell us the website one more time.
So you can go to whoaretheyleavingout.com, or you can go to mccl.org, and you can find that information there as well.
Thank you so much. We really appreciate you coming on, and thank you so much for all your hard work to protect the vulnerable, for protecting women, preborn babies, those who are aging, and those with disabilities. We've got to be the voice for those who have less of a voice or no voice. And we're so grateful for the work you do.
Thank you. You know, when we use our voice, we can win. We have had victories over the last 2 years, and it's because we are sharing information. So when we share this information, even though people find it unbelievable, when they look into it and they find out it's true, they will change their vote. So share the information because we can stop them.
I love that. Do you want to take just a minute to tell people about your most recent victory that you did have, so that we can all be encouraged on that? And we'll end with encouragement.
Yes. So we were able to stop the ERA from going to our ballot. And the way we did that was we had an awesome ad campaign, but we also worked really hard to just educate people on what our laws really are. And we were actually able, through education and through a television ad campaign, we actually moved public opinion 9 points, which is about as much as you can expect one campaign to move public opinion in our favor. People just came away from that saying, if that is true, and if you can show me that that is true, that is not what I believe. I don't want it in my law, and I want to know who voted for it. So that is tremendously hopeful. That is doable. We can tell people what the truth is. We can show them what the truth is, and they will vote their conscience. They don't agree with those extreme policies, and they will change their votes if they believe that it is true.
It's such an important reminder. And, we too, if we work together, we've got to stay united as a movement and also continue to bring more people, reaching more hearts and minds with these messages. And as they understand and their eyes are opened to the reality, that pendulum will swing. So we've got to keep going. And, we've had some great successes in our state as well, that we have been, we've had some great successes in our legislature. And a lot of it was through that education piece, helping people to understand, what was truly at stake and how we can work to save lives through other measures. If we can't regulate abortion in our state, but, if we can do other things to support women and to protect life in other ways, then we can continue to have successes, and we just have to keep working at it. So thank you so much for that encouragement and for reminding us all to stick with it. We're going to keep going, and we're not giving up.
Pro-lifers don't quit.
No.
Pro-lifers don't quit. We're working for the most vulnerable. We're not working for money. We're working for the most vulnerable, and we just are in it for the right reasons, and that is what gives us our strength.
I love that. You're so, so right. Thank you so much, Cathy.
Thank you.
Yeah. Okay. So to our listeners too, we hope you like this episode. It was fun. We learned a lot of great things. We even left with a little bit of encouragement. So we hope you liked it and that you will share this with a friend. If you do want to do that, just click the share button down below. Make sure you're subscribed so you'll be notified first about future episodes. And as a quick reminder, if you love drinking delicious coffee, please consider trying 7 Weeks Coffee. It's the only coffee company that donates 15% of its sales back to the work of pro-life organizations. You will find a link to purchase 7 Weeks Coffee on our homepage at kfl.org, and that'll direct part of your coffee purchase to benefit the work of KFL and this podcast. So, until next time, never forget, the pro-life movement is on the right side of history. Truth always wins in the end. Thanks, friends. We'll see you soon.